Okay, good afternoon, everyone. So please tell your friend because we will start now. I already told we will start at 3 to 4 p.m. So let's review the scenario 6 to find out what we want to learn this time. So the keywords first is the boy was very active and he could not stay still and he was unable to communicate. And the fourth keywords that the dentist could not make behavioral approaches. And the fifth keywords is specialist dentist. And six, non-pharmacotherapy or pharmacotherapy approach. Okay, so based on the group A define the learning issues as shown on this screen. And the unanswered questions, I think those belongs to oral biology. So I assume that you don't have any question in pediatric dentistry. So next, group B. Group B, your learning issues were also focused only on ADHD, autism, and hyperactive. And the unanswered question was about the stage of the general anesthesia. Okay, and the group C, the learning issue and the unanswered questions were a bit different from those previous two groups. This group C mentioned about the classification of special needs patients, about the pharmacological therapy, the referral system to specialist dentists, and the unanswered question is about what are the competency of general dentists for managing special needs patient, and also what are the behavioral guidance for physical impairment children. Okay, so here are the overview for today based on the pediatric dentistry point of view. So actually, in this scenario, we will learn what is the definition of special healthcare needs patient, and then the classification of special healthcare needs, and also the behavioral guidance for managing the special needs patients. So have you heard about this terminology? What do you think? Which one is called special needs or special care? Or even sometimes people also call it as people with disability. So actually, all of those terminology are correct, but recently, the American Academy of Pediatric Dentistry in 2021 changed the special needs terminology into the special healthcare needs. This because to differentiate the terminology of special needs in academic or educational purpose. So based on the AAPD, the special healthcare needs are defined as any physical, developmental, mental, sensory, behavioral, cognitive, or emotional impairment or limiting condition that requires medical management, healthcare intervention, and or use of specialized services or programs. And all those conditions might be congenital, developmental, or acquired through the disease, trauma, or environmental cause. So next, based on this scenario, it talks only about a boy who seems hyperactive, right? And from his condition, we can conclude that he was a special patient because he needs special consideration before he can, before the dentist can give the treatment to him. So we acknowledge several types of special patients depends on the challenge. We divide into 5. Intellectually challenge emotionally, physically, medically, and genetically. And also, based on the definition that APD already defined, we also acknowledge this classification of special patients, also divided into 5 types. Use both of the system classifications, so you don't need to confuse which one is correct. Because these two systems actually is associated. So for example, like this behavioral disorder, this is actually related to the emotional challenge. And like this intellectual challenge is also related to the cognitive disorder. And also systemic disease, this is also related to the medical challenge. So you don't need to confuse about these two systems. So let's start discuss one by one of the example of this classification. So we start. Yes, Felicio?
Doc, may I ask?
Yes.
Aren't all of the special care children genetically challenged?
No, not all of caused by genetically, because we will talk about this genetically later, right? So you will know not all of this condition comes from that gene mutation. So first is the behavioral disorder, or sometimes people call it like emotional challenge. The example of these types, like anxiety patients, like patient really anxious, and also autism spectrum disorder, and also ADHD patients. So for autism, this condition is called spectrum, because actually this is a group of developmental disorder and has the significance of symptoms. First is they have the impairment in social interaction, and also unable to communicate, and they always show the atypical behavior and atypical interest. And this patient also has a sensory impairment, so they can overreact to noise, sounds, taste, smells, and also lights. And the other example from this behavioral disorder is ADHD, attention of deficit hyperactivity disorder. This is when someone is having atypical ways of paying off attention. And usually they have a problem to filter the incoming stimulus. And next is congenital, or we call it genetically challenged. So which means all of these conditions have been acquired since birth, caused by mutation of genes during developmental in the preterm stage of life. So typically this condition, we call it as syndromes, like trisomy 21 or Down syndrome, Pierre-Robin syndrome, or another syndrome. So this answer definitely your questions that not all of the special healthcare needs is because of the gene mutation, because some others can be caused by the developmental or trauma during in childhood to the adolescence. But if this condition caused by genetically, so it must happen since the preterm in the stage of life. So Felicio, now you understand?
So ADHD is not like genetic, Doc?
No. But some scientists also have another hypothesis about this autism or ADHD, that they also think that this condition is caused by the some gene. But actually, this ADHD or autism is more to the neuropsychiatric disorder, not to the genetical or mutation gen condition. Because if it happened because of the gene mutation, so all of the systemic body will change. Do you understand?
Yes, thank you, Doc.
Okay, so next, for the example of the congenital disorder, is Down syndrome. So I bring up this topic because the prevalence of Down syndrome is higher than any other syndrome. So the chance for the dentist to meet this patient is also high. So Down syndrome is caused by the aberration chromosome 21, which can be duplicate in chromosome 21. So we call it as trisomy chromosome 21. And then also it can be caused by the translocation of chromosome 21 to the chromosome 22, or translocation of chromosome 21 to the chromosome 12. So because of this aberration chromosome, so it will affect the whole of the systemic body of this patient. So the most common manifestation is the intellectual disability and the unique physical appearance. And for the intraoral manifestation, including this microglossia, so the tongue is bigger than typical people and have the fissure on the tongue. And usually because they have the mouth breathing habit, so usually they tend to have a saliva drooling, and the maxillary shape is shaped like a V, like Victory, and also narrow, and has the high periodontal disease compared to the typical people. So next, for the cognitive disorder, or sometimes people call it as intellectual disability. So this condition can be happen because of the brain injury or brain infection during the childhood, and also can be caused by the syndromes that associated to mental or intellectual disability, such as like Down syndrome in the previous slides, and also can be caused by the global developmental delay. So, cerebral palsy is a good example condition of the intellectual disability, and also a good example of physical developmental disorder. So actually, this is a neurological disorder caused by the abnormality in the part of the brain that control the muscle movement. And the location of the brain that which has the damage will define the types of cerebral palsy. And the causes could be a brain damage, brain infection, like for example, maybe this patient when he or she was in 1 year old or 2 year old, they have a meningitis or encephalitis infection. So it can cause the brain infection, or maybe they had a head injury from fall or child abuse in the first few months or years of life. And the signs of cerebral palsy is lack of the muscle coordination. Also, muscle tone is too stiff or too flexible, or sometimes they show like a spastic condition. Okay, and next, classification is systemic disease or medical challenge. Is including like hematological, it means the blood disorder, cardiovascular disorder, gastrointestinal, cancer, renal disorder, respiratory, endocrine disorder, liver, or even the HIV infection. And next is physical impairment. These include the hearing impairment, visual impairment, speech impairment, or even the low-tone muscle people or patient who cannot walk or cannot move his arm or his leg. So after you learn all those types of special needs patient as on the challenge, so you need to know which behavioral approach that should be selected for the patients. So first to do, like I already showed in the clarification of scenario 2, that please don't forget about our pediatric dentistry triangle. We also use this concept for managing special needs patients. So please review our topic in scenario 2. So we have several techniques of behavioral guidance have the same basic goals. It has to build communication, to establish the positive image of dental treatment, to give the safe and accurate dental treatment, and to build the good oral habit. And the selection of this technique is tailored to the needs of the individual patients and also the skills of the practitioner. So basically, all of these basic behavioral guidance are suitable to apply for special needs patients, except the voice control. So since all the general dentists can apply this guidance in daily practice, so the general dentist can apply these techniques when giving treatment to the special needs patients. In addition, there are few additional behavioral guidance that consider for special needs child. So we will discuss one by one. So first is sensory adapted dental advancement. Yeah, you can record, or SADE. So this technique is combined any adjustment of sensory approach to reduce overstimulation of the sensory. So usually this technique is used for the autism patient.
Recording in progress.
And next is AAT, or Animal Assisted Therapy. So this technique also legally can be used in several countries to reduce anxiety in patients. But this animal is not your pet or not the patient pet. This animal should have the certified and trained animal and also needs to accompany by the keeper. And next is Picture Exchange Communication System, or PECS. This system also can be used for nonverbal communication patient, including the autism patient or ADHD patient. This system like a tell show the technique, but using the picture. So here are the example of PECS. So one picture resembles one word, and you can arrange these pictures into one concept. Next is the advanced behavioral guidance. So please remember, only the specialist who can select or choose this guidance. So first is protective stabilization. It has two types: the passive restraint, which means use the tools like pedi wrap or purpose board, like in this picture, to immobilize the patient during the treatment. Meanwhile, the other types is active restraint. It means we use the human body to immobilize the patient. Usually, the mother or the father or the parents can hold the child. So we call it as active restraint. In US and European countries, This technique is not popular because they said it against the human rights according to their laws. And to keep the mouth open, this is the secret weapon of pediatric dentist. We can use Sp.KGA or we can use bite block, like these 3 types. It will help keep the mouth open and preventing finger bite during the treatment. But please remember, this is not part of protective stabilization. This is only the tools to keep the mouth open. Next is sedation. So sedation can be given by inhalation sedation, oral sedation, or intravenous sedation, or intramuscular sedation, or even in the rectal. So the aims are for the safety reason for the dental treatment and the patient, while also reducing the anxiety. So the choice of which type of sedation should consider for the rapid onset, but also with the minimal side effect. So this technique or this sedation is the last option when the basic guidance is not working for the uncooperative patient. So when a dentist consider to choose for sedation technique, he or she should also consider the length of working time.
You wanted to present that to me.
And usually maximum time is 1 hour. So beside the type of sedation, the dentist also should consider the level of sedation, whether it should be minimal or moderate, or even goes to the deep sedation, or goes to the general anesthesia. So please note the difference in airway, respiratory, and also circulation among these different level of sedation. And dentists are eligible to do sedation until this level, moderate sedation. For this deep sedation, we need help by the anesthesiologist. So we cannot perform this deep sedation by ourselves. So it should be the anesthesiologist. And also the general anesthesia, it must done by the anesthesiologist. So inhalation sedation using nitrous oxygen, or we call this as happy gas, is common in dentistry. And in Salemba, we have it, and the postgraduate students of pediatric dentistry have been trained to use it. So if we want to use this technique, we need to have 2 operators. One is in charge to the dental treatment, and another one is in charge to the equipment and also monitor the vital signs of the patient. And the patient are still awake during the dental treatment and should be in response when you're talking to them. But he or she might feel sleepy and feel relaxed. And this technique is suitable to the anxious patient, but the patient is able to communicate because you need to always check the level of conscious by proactive talking to them. So we cannot use this technique for the uncooperative patient and those who are unable to communicate. And the last option is general anesthesia. So you need to consider the excessive of dental treatment needs and the cooperation level of patients. This GA is suitable for the uncooperative patient who are unable to communicate and those who needs immediate dental treatment, but should be the comprehensive treatments, or those who are contraindicated for local anesthesia. So in planning the dental treatment under DGA, so you need to plan carefully since the pre-operative through the post-operative. And you need to work together with the anesthesiologist, the pediatrician, the radiologist, and also in the lab technician. And a comprehensive dental treatment could be done under GA. So next, I will give you some summary for highlight cases. First, for the intellectual disability, you can modify the Tell-Show-Do technique with the PECS because it's easier for them to understand the instruction. Like this. This you can download in internet. So many, or maybe you can make by yourself also, it's okay. And for the physical impairment with the long tone muscle, they need some support on the back. So you can adjust your chair by adding soft cushion, especially for the cerebral palsy patient. You need to support the neck. Or also you can think about sedation or GA as an alternative way. So next, for the sensory impairment, don't like hearing impairment growth, or it will be a bonus if you or a dentist can communicate with the sign language. Or if they can read the lip, you can remove your mask while talking to them before the treatment, or you can communicate with the written notes. So you can change the memo between you and the patient to give the instruction or to explain what you will do today to the patient. And for the visual impairment, you can modify the Tell-Show-Do into the Tell-Feel-Do because usually the visual impairment person will have the strength in perception and auditory sensory. So you must maximize it. So in this left figure is the example of our postgraduate student invented. She created a model for teaching oral hygiene for the visual impairment children. So next, for the autism, you can use social story for introducing dental treatment to them. And because the autism people like a routine activity, so it is best to make a schedule in the same time with the same dental team, same dentist, same dental nurse, and also you need to give the clearly instruction. And for ADHD, you can also use this social story before the appointment. And it's best to reduce the distraction in the office so they can focus to the treatment. So in this scenario, you have been learned if you meet the special needs patient. So please remember, first is to make the behavior assessment. And it would be better if the parents already give the information before patient visit, before the first visit to the office. Then, when you finally meet the patient, you must identify the appropriate behavior guidance. And the last is to adjust the techniques based on the child's needs and the skills of the operators. If the operators have limited skill, then the patient must refer to the specialist in order to give the best treatment to the patients. So good luck for the exam. So do you have any questions?
Doc, may I ask?
Okay.
This is like cerebral palsy. Is like they have like poor muscle tone, and how to use the general anesthesia, because like some general anesthesia like benzodiazepines or maybe barbiturates, they have like of like muscle relaxation and how to use it to the cerebral palsy.
Okay.
Patient.
So, do you know how the general anesthesia works?
There are like 4 stages of general anesthesia.
No, I mean, do you know, what to say? This target, the general anesthesia targets what? Do you know if?
CNS.
Okay, so it means in the brain, right?
Yes.
Yes, in the brain. Okay, so the general anesthesia target the brain. So it works mainly in the brain. It makes the patient sleep during the treatment, right?
Yes, Doc.
Okay, so you asked about the movement or the muscle tone of cerebral palsy, right?
Yes, Doc.
So it's okay. The general anesthesia is the best option for the cerebral palsy because you can avoid the involuntary movement of the patient. You know, some cerebral palsy cannot control the movement. So sometimes they can be spastic without any stimulus during the treatment. And if they do like this, it can harm himself, and also it can harm you because dentist is working with the always the sharp and machine, right? So this medication in general anesthesia, now they use the sevoflurane. This is the gas. It works in the brain, right? So it will not affect the lower muscle or the lower muscle of the patient. So you no need to worry about it.
Okay, thank you so much, Doc.
Okay, so do you have any other questions? So actually in this scenario, we want to how to say, we want to introducing there are types of special healthcare needs people that you can meet in your daily practice, and you need to know how to classify them, and you need to know the basic behavior guidance that you can do as a general dentist before you can refer them to the specialist dentist. So actually this is the target of this scenario 6. So for the exam, you must review again of the non-pharmacotherapy techniques, and also now the pharmacotherapy techniques, and also the types of special needs patients. Oh, okay, Kesa, you have questions?
I have a question. So for like children that are very hyperactive or like autism that need treatment to go to dentist, do we use the nitrous oxide or we just revert to like the general anesthesia instead? But they have like severe symptom like condition like caries maybe. Thank you, Doc. That's my question.
Okay, so for the you asked about the sedation inhalation, right? The happy gas, the nitrous oxide oxygen. So yeah, so I already mentioned before that the indication for the this is not. So for using this nitrous oxide inhalation, the patient should can communicate. Why? Because this is the conscious sedation. So it means the patient relaxed but not sleeping. He or she is still awake and must respond verbally. So during the treatment, you need to ask to the patient and the patient can respond. So if this patient autism or ADHD can communicate well, can communicate in two ways verbally, yes, you can use this nitrous oxide oxygen inhalation. But if they cannot communicate, you cannot maintain the two-way communication. So the option before the general anesthesia, you can use the intravenous sedation, and the last option is general anesthesia. So please remember for choose this technique, nitrous oxide oxygen inhalation, so the patient should be able to communicate.
Okay, Doc, thank you.
Okay, any other questions? Maybe if you are still curious about this agent, like how this mechanism of nitrous oxide or how is the mechanism of barbiturate, maybe you can ask to the oral biology resource person. Okay, no other questions? Okay, if no other question, I think I will dismiss this class now. So please remember what I say for the exam, yeah? You need to capable to classify the special needs patient, and also you need to learn what is the appropriate behavioral approach for the special needs patient and also the typical patients. Okay, so if no other question, I will dismiss this class. So thank you for your attention. So I will leave now. Okay.
Thank you, Doc.
Thank you so much, Doc.
Record.